Welcome to the Friday Focus. My name is Dr. O from E&S Orthodontics, and I wanted to welcome you to 2015. We're really looking forward to bringing these types of videos to you on a weekly basis, and I really look forward to being able to communicate with you, to be able to educate you on everything that you may need to know about orthodontics, dental care, or anything that may apply to helping you get a better smile. Today, we're going to focus on one of the most interesting questions that it's a topic of debate, and it's something that a lot of parents also ask when they come into the exam. And the question becomes, when should I have my child have an orthodontic screening? Now, what does that mean? Orthodontic screening is an AKA for an exam. When should you bring your child in for an exam? And the American Association of Orthodontists recommends that all children be screened by the age of 7. And they be screened at the age of 7 doesn't mean that they will actually undergo treatment. It just means that an orthodontist is going to be able to look at your child and determine whether anything needs to be done or not done. And so in the frame of reference, like when we were asked the question, we have to sort of overcome a lot of sort of myths about orthodontics. And one of the myths is that children, in order to see the orthodontist, one has to have all their baby teeth gone. And that is false. That is one of the things that we kind of want to dispel. You do not have to wait to have all the baby teeth gone before your child gets an orthodontic screening. Number two, one of the things that we want to do is we also want to sort of take away the myth of that your dentist has to refer you in order to see the orthodontist. You are able to come into an orthodontic practice for a general screening anytime that you feel you want to have any type of questions answered. I also encourage parents to do that because that's one of the ways I always say, like, I like being the quarterback of your child's orthodontic care. And what I mean by that is like I can give you a sort of an overview, a bigger perspective on what needs to be done both dentally and orthodontically for your child. And sort of just give you just like a broad, hey, we need to do this and this type of sequence. But going back to the age of 7, a lot of parents will say, well, why the age of 7? And this is a really fundamental question. And the reason is that one of the things that makes us our practice or orthodontics so special is we are the first medical or dental practitioner to be able to make an assessment of your child's facial features. And I really get excited about that because it's not your pediatrician, it's not your pediatric dentist, it's not your general dentist. It's really, we're the first medical or dental persons that get to make an assessment of your child's facial features. And so the reason that we want to see the children at the age of 7 is usually by the age of 7, your kids usually have their 6-year molars are in. And those are your first molars or their first permanent molars. And the way I like to describe that is I consider the first molars to be I like to give parents and staff and everyone kind of a football analogy. And so really, what happens is that when the 6-year molars are in, if you can equate them as the sidelines of the football field, then that gives us a basis of whether the top jaw is wide enough for the bottom jaw. And so having those 6-year molars in really gives us the first ability to assess whether your son or daughter, whether their top jaw is wide enough. The second is by the age of 7, usually your children have their four adult teeth on the top and the bottom end. And so when we have those teeth in, I like to equate those as being the end zones of a football field. And see, most parents, like when they come in or they get concerned about their child's well-being, they're always concerned about a child's overbite, which means to a parent, that means like your son or daughter's top teeth stick out way in front of your bottom teeth. And so the way I kind of use the football analogy is like most children, or most times, we want the top teeth for your children to be at the 50-yard line of the football field. And usually, so we want the top teeth to be at the 50-yard line. And so then when a parent says my child has an overbite, what they're really saying is the top teeth are at the 50-yard line and the bottom teeth are at the 35-yard line. And so when we're doing a facial assessment, one of the things early on at the age of 7, we can kind of predict whether your child needs to have some type of growth correction in the future. And that's a really important thing because in 2006, one of the most popular TV shows was Extreme Makeover. And in that show, people were just doing crazy stuff. They would do chin implants, they would do cheek implants, they would do Botox injections, they would do all sorts of crazy things to do what? To make themselves look younger. And what was really interesting at that time, Barbara Walters and The View did a special on the impact of orthodontic treatment on a growing child. And if you timed their orthodontic treatment at the right age, you could create or mimic those things that people were doing later in life with surgery or some other crazy stuff like I just mentioned. And so Barbara Walters showed different patients at that time who had gone under orthodontic treatment and just had fabulous outcomes. And so when we talk about like being able to predict and sort of guide you in that whole process, that's really what we want to do at that first screening. We really want to create that foundation so that you know whether you're comfortable or not, whether your child needs to have growth correction or not. And so those are things that we sort of get to determine at the age of 7. And I think that's so like fantastic because like as a doctor, like I really can have an impact on the future of what your child will look like from the orthodontic treatment. And so when we're looking at all this, like when we start to put it all together, that becomes a really important time period for us. So at the age of 7, what we're looking for is that really, now that we have the 6-year molars in and then we have the front 4 teeth in on top and the bottom, now we're able to make those predictions, but more importantly, we can start determining whether your child needs any type of interceptive orthodontics. And what I mean by interceptive orthodontics is we were trying to determine whether your child has a certain particular problem at that particular age that needs to be addressed. And for that to be addressed, what we want to do is look at, does your child have enough room for the 4 adult teeth in the front? Do they have any cross bites, which means are the top teeth more narrow than the bottom? So those are just things that we're looking for at the age of 7. And that's why we really get to know, like it's amazing how much information we can glean at that time. And so that's really one of the things I kind of want you to really look focused at is if someone was to ask you, what age should your child have their first orthodontic screening, you want to say the age of 7. And like I said before, you want to kind of get rid of those myths about, oh, I have to wait for all the baby teeth to fall out, or I have to have a general dentist refer me into the office. Those are just myths. And so really, give us a call. We're more than happy and be delighted to kind of work through and determine whether your child needs any type of orthodontic care or any type of growth correction in the future. And we really want to make that prediction early on. Because the earlier we do it, the earlier we can determine whether anything needs to happen, the better results that we're going to get for your child in the future. Well, I hope this starts to give you a little bit more information on why we want to see children at the age of 7. And one of the things that I'm looking forward to as we go forward is really starting to expand upon this topic because it really doesn't stop here. There's a couple time points in children that we really want to hit and focus in terms of making you confident with yourself in terms of determining when your child should start orthodontic treatment. Again, this has been the Friday Focus. My name is Dr. O. We look forward to seeing you in the office and make 2015 a beautiful year. Talk to you soon.